Knee fractures, causes and symptoms. The knee is the largest joint in the body and one of the most complex. A fractured knee can cause pain, swelling, and reduced range of motion. Treatment for this fracture may involve surgery or casting. A knee fracture is an injury that causes damage to the patellar bone in the knee joint. About 1% of all fractures in humans are patellar fractures. Fracture is the medical term for a broken bone. Knee fractures may result from a direct blow to the knee or from the leg twisting while it is bearing weight. A person with a fractured patella may have pain in their kneecap and difficulty moving their leg. This video explains the symptoms and causes of a knee fracture. It also discusses types of fractures, treatment, complications, and more. What is a knee fracture? The knee is a hinge joint consisting of three bones: the femur or thigh bone, tibia or shin bone, and patella or kneecap. The knee allows the leg to bend and strengthen. Doctors may also call a knee fracture a patellar fracture. A patellar fracture is a break in the round patellar bone. Ligaments attach the patella to the quadriceps muscles in the thighs and to the shin bone. Doctors classify knee fractures into types depending on their severity and the displacement of bone. Symptoms of a knee fracture. The symptoms of a patellar fracture include pain, swelling, bruising, and inability to strengthen or bend the knee. The ability to feel the break through the skin. Types of knee fracture. Doctors categorize fractures into different types depending on the exact displacement of the bones. Stable or non-displaced fracture. In this type of fracture, the pieces of bone remain either in contact with each other or just a millimeter or two away. Stable fractures usually heal easily. They occur when there is no break in any of the bones, but there is a crack or chip in one or more of them. Displaced fracture. A displaced fracture occurs when a break in one or more of the bones causes the bones to shift out of place. They do not align properly, and this type of fracture often requires surgery to realign and stabilize the broken bone. Comminuted fracture. The bone shatters into three or more pieces in this type of fracture. To diagnose a comminuted fracture, a doctor will examine the bone. If the pattern of the fracture is stable, it is best to treat the injury with immobilization. If the fracture pattern is unstable, surgery may be necessary to repair or remove one or more pieces of bone. Open fracture. In an open fracture, the bone breaks so that bone fragments stick out through the skin or a wound penetrates down to the bone. This often damages surrounding soft tissues, which can take time to heal. A break in the skin causes an open fracture. This type of fracture is particularly serious because it carries a high risk of infection. The bone breaks the skin, and bacteria that usually live on the body can enter the wound and cause an infection. Causes. A knee fracture may happen after a person falls directly onto their knee. It may also happen when the knee receives a direct blow, which may occur while playing sports or during a vehicle collision. People with health conditions that cause weak bones, such as osteoporosis, may be more likely to fracture their knee. Diagnosis. To diagnose a knee injury, a doctor will first ask about a person's symptoms. The doctor will examine the knee to check for tenderness, stiffness, and swelling, and check the person's range of movement. If a person has a displaced fracture, the doctor may be able to feel the fractured bone through the skin. They may arrange for an X-ray to confirm the diagnosis. They may also order an ultrasound or radiograph. Treatment. Doctors will recommend surgical or non-surgical treatments depending on the severity and location of the fracture. Non-surgical treatment. The treatment for hairline breaks is immobilization for a number of weeks. Doctors may apply a cast or splint to the knee to prevent movement and keep the bones in place while they heal. Some people may be able to bear weight on the leg while wearing a cast, but this is not advisable for other fractures. A doctor will give guidance based on a person's injury. Surgery. If a fracture involves any displacement or other complications such as dislocations or open wounds, then surgery may be necessary to repair the damage. Surgeons can realign the knee and remove any unnecessary bone fragments. They may use screws, pins, and wires to hold the pieces of knee bone together. In comminuted fractures, some pieces of bone may be too small to reattach. The surgeon will remove them and reattach the patellar tendon to the remaining patellar bone. Complications of knee fractures. Many complications can arise from a knee fracture, including post-traumatic arthritis. The most common complications from a knee fracture is post-traumatic arthritis, a type of arthritis that develops after an injury. Post-traumatic arthritis occurs when there is damage to the cartilage covering the ends of bones. Over time, cartilage loss means that bones rub against each other, causing inflammation and pain. Chronic pain. Many people experience long-term pain after a knee fracture. According to the American Academy of Orthopedic Surgeons, it is not clear why some people experience this, but it may be related to post-traumatic arthritis, stiffness and muscle weakness. Wearing a knee brace or other support may bring relief. Muscle weakness. A knee fracture can injure muscles and other soft tissues around the knee. A person may have permanent quadriceps muscle weakness in the front of the thigh after a fracture. They may also have a reduced ability to bend and strengthen the leg. When to contact a doctor. If someone injures their knee, they should try applying ice to it and using pain medication. If the pain does not subside or worsens, people should contact a doctor. People should also seek medical advice if they cannot put weight on the knee. Notice swelling. Have a high temperature, feel hot and cold at the same time, and have redness or heat around the knee.